everyone. It is Tuesday. You know what that means. It's either going to be a trash talk or it's going to be a doc talk. And this one, we're not so sure which it is because we're both kind of like, I don't know. We wanted to talk about joint pain. We're not necessarily trashing joint pain, but we're going to talk about different reasons that people claim you can have joint pain and whether or not it's any good. What do you think about that?
I don't know much about it.
Well, how about that? I'm gonna pitch some ideas at you, and then you're gonna just say what you think.
Oh, okay. I can do that.
Okay. So we're not sure if this is gonna be a doc talk or trash talk. It's gonna be something. Okay.
Yeah, I'll definitely tell you what I think.
Joint pain.
I can start with this video right now and tell you what I think.
Oh gosh. You know what? You gotta quit acting like you hate these, because we all know that you love them. This is your favorite part of the week.
You down denial, girl. You need to get a pat.
What did you just say? I what?
You down denial. You need to get a pat.
Oh, down denial.
You need to get a pat. Get the hell out of denial.
I'm sorry. What is it? Matt County twang is coming out. I can't understand what you're saying.
Matt County too.
Didn't you come from Matt County?
Yes. Did I come from
Max Creek.
Oh, no, that's different than Matt County.
Okay, where are you from?
Oh, don't worry about it. Same
Okay,
person,
I'm
sure.
sorry, but sometimes your Ozark comes out and we don't know what you're saying. He loves this stuff. He enjoys this. So guys, don't let him fool you. Okay.
Are we done with this video yet?
Yep.
Okay.
That's it, everyone. Thanks for watching. Okay, joint pain. Does joint pain sometimes caused by extra weight?
Can be.
Okay, and
A lot of times.
at what point? And is it usually just the knees?
Well, it's usually knees and back. Hips, especially in women, because their hips are built differently.
At what percentage is it that you're overweight usually as it start affecting your joints? Anything over 10 pounds?
Oh, everybody's joints are differently. It depends on your joint build. If your bones are bigger, you got more surface area to absorb the weight. So if you're more petite, it can be a bigger problem, which is why I think women have bigger problems with joints than men do.
Mm-hmm.
But weight can do it. And there's certain other conditions, arthritic conditions, infections. Just a whole host of things can cause problems with joints.
So I read that texting also can cause joint pain in your neck.
Yeah, cause automobile wrecks too.
Yeah, then you'll have all sorts of pain.
Yeah, I'm going to have a lot of joint problems.
But one that, actually my chiropractor told me I have cell phone neck. We're shocked. Okay, we're all shocked. But from just leaning your head down. One of the things he told me to do is put roll up a towel behind my neck and just lean backwards a little bit. Because he said that all of our necks are starting to take a different shape entirely. Because normally the neck kind of has a bend in it.
There's something else you can do too. I don't know if you know this.
That?
You can put a plastic bag over your head, tie it real tight.
I
don't think it's going to help you.
No, because I'm a zombie. I will always come back. Okay, high heels.
I don't think because the pain on the joint's going to be in the feet.
Mm-hmm. But it can take long-term.
Mm-hmm.
It can have long-term damage.
Eventually, if you put enough high heel pressure in those feet and those toes, you'll eventually get what they call a valgus vargus deformity, where your toes will crinkle up and cross over, and you'll have to have surgery and bunion removal.
Ooh, yikes.
I never understood why they
and
wear
a
my
lot
hands
of the weight is literally being...
it's right on the ball, too.
Exactly.
Yeah.
Okay, so using the wrong muscles to lift things or, do it...
Yeah, this is something we're all guilty of. Use your back. This is really important.
Mm-hmm.
A joint that's not in motion cannot be hurt. So you can't sprain an ankle if you're just standing there, okay? So your back is the same way. It has a lot of joints in the back. So use your knees, not your back. Okay. Now, everybody's guilty of this, including me. Mm-hmm. But I'll be honest with you, the older I get, the more I use my knees a lot more because freaking back hurts all the time.
Mm-hmm. Well, dang.
Because I abused it.
Well...
like every other organ and part of my body.
They also talk about the back when you sleep on your stomach a lot. They say sometimes sleeping on your stomach can cause back pain.
Yeah, without a lot of proper support in the mattress. Typically, people with a lot of back issues like a firm mattress because if you're sleeping on a bed that kind of goes like this, you can actually get a thing called spondylolisthesis, spondylolithosis, where the facets or the joints in the back will actually start cracking and stretching. It's really kind of weird. They get what's called a slip disc. A lot of people have said, I got a slip disc on my back. That's what that is. The joints have microfractures in there, and they're healing, but in the process become elongated. And it can pinch on the nerve roots, cause leg pain on both sides. So yeah, sleeping on your stomach can cause that.
Okay, now I'm just going to run through several of these so our video doesn't go too long.
Okay.
You just interrupt me whenever you hear one that you think we should talk about. Don't lift weights. So if you don't lift weights, you could be causing more issues because your muscles are weak. Correct? Smoking tobacco?
I don't think it has much to do with it.
Okay. Well, I read that it causes damage to your bone health, which could cause joint pain. That's a stretch.
I'm going to call BS on that one.
Okay, using your computer a lot, so sitting and having the same motion every day, same position every day. Does that cause much over time?
Can, but
sitting. Okay. Wrong shoes. Wearing the wrong shoes.
Of course, that hurts. Don't wear them.
Okay. Cracking your knuckles a lot.
Has nothing to do with joint pain.
Okay. Carrying too much stuff. So if you're carrying a bag around, ladies with our purses and dumping everything.
Or too much weight. Yeah, too much weight. Yeah.
So people who skip stretching, it can cause some joint pain over time.
No.
Okay. Not enough sleep?
Probably too much sleep, actually. Can cause joint pain.
That's interesting.
Yeah, it is.
Because you're just in one position for a
No,
while.
this is really kind of interesting. And I want to stop you here because the cartilage in the joints, okay, like we'll just use your knee. We'll use the example of a turkey leg, okay? It's got that clear stuff on the end of the leg. That's actually cartilage. Now, that's living tissue, okay? But the problem of it is there's no blood vessels or nerves that go to it, which is why when we have to replace a piece of cartilage on our own knees, we can take a piece from a cadaver. It doesn't matter who it is. We can take a piece of their cartilage and put it in your knee. Don't have to worry about rejection of the graft. And the reason why there's no blood vessels and there's no nerves to connect, you just tack it in there with some biotech anchors, Zyrtec anchors or something, and it'll stay there and thrive. But what it needs to thrive is two things: a little bit of oxygen and some fluid. Well, how do you get the fluid into the joint? Well, every time you take a step, and this is why doctors say, oh, you got arthritis, you need to walk a little bit, it's good for the joints. Well, that's true, because every time you take a step, you squeeze the cartilage, squeezes out the toxins, and when you unload the joint, it's absorbed back in. So it's more of a sponge bob effect. It's absorbed back in, so it's more of a sponge bob effect. We wake up in the mornings, our hands are stiff and tight. Well, after a few minutes, they loosen up and we're fine. Same reason, the joints in the hand starved for nutrition while we were sleeping too much, and you get up and move around a little bit, joints loosen up, you're ready to go.
Cool. Well, I think that was more of a doc talk.
That's doc talk.
Okay, but I think that's good
Wish there was a trash
information.
talk.
If you do have joint health, I just got a text from Chantel that says we have a few patients waiting, so we'll cut it out for now. But if someone is having joint pain, if they're having issues with joints in general, do you have any recommendations?
Yes, we can tell you what your joint problem is.
Okay, but long-term joint health, is there a certain kind of doctor you should go to? Primary doctor?
Yeah, primary care doc.
Okay.
I mean, I wouldn't waste my time.
And then they'll route you if something gets more serious to the right place. Okay, cool. All right, well, there's our doctor for the day.
Have a good Tuesday.
Have a good Tuesday, and we'll see you Friday for Free Advice.